Hi, I'm Dr. Jane Healy. I'm one of the pediatricians here at Trillium Health Partners. Viral season is upon us. We're seeing lots of viral infections in the emergency department. One of the most common presentations in babies and young children is a condition called bronchiolitis. Bronchiolitis most often results from infection with the respiratory syncytial virus, or RSV, as well as other viruses. While this may cause the common cold in an older child or an adult, in young babies and children, this can make them quite sick. Many babies will become congested. They'll have nasal congestion, and this can sometimes make it difficult for them to feed. What you can do at home is you can ensure that baby's nose is clear by putting in nasal saline drops and suctioning out the nasal congestion. Doing that before feeding can help clear their nose and help them feed. You may also find that babies don't feed their usual length of time. They prefer to feed for shorter periods of time more frequently. Things to watch for and to bring a baby or a child into the emergency department for assessment is if they're not feeding well, you're noticing that their diapers are not as heavy as usual, if they're not waking to feed, and most importantly, if they're showing signs of respiratory distress. What you can watch for is their nose flaring, this area of their neck sucking in. You may notice blueness around the lips, and also sucking in under their ribs and between their ribs. Those are all signs of respiratory distress and would be very worrisome. You would want to bring your baby or your child into the emergency department for assessment in that scenario. Many times bronchiolitis can be managed at home as long as these concerning signs are not present, your baby is still feeding regularly, making wet diapers, and does not have signs of respiratory distress.